Hey guys, good evening. Good evening. Happy Monday to everybody that's joining right now. I'm just getting logged in here. I'm just going to YouTube right now so I can pull up this video and I'm able to see the comments. Let's see live. Go here. How's everybody doing? Hey Quizm. Hey Yanni. I see you guys watching from both Facebook and YouTube. All right, let me click on this. Why is this not opening up? Let me see. Sorry guys, my phone is acting up, acting weird for some reason. It won't let me click on the live video. Let's see now. Okay. Yep, just continue to let me know where you guys are watching from. Yes, Jennifer, it is going to stay on the channel. So after the live, it will stay on the channel. Hey Heather, I'm glad you made it. All right, guys, we're going to start in one moment. I'm just pulling this up on my phone here. We're going to get ready to get started. Now, is there anybody here watching for the first time? If anybody is watching for the first time, I just want to introduce myself to you. My name is Kendra, aka Miss K. I am a medical assistant instructor. I've been an MA since 2004 and an instructor since 2011. Outside of teaching medical assistant, I'm also an author and preneur. And more than anything, above all, I am a mommy. My daughter is 18 years old. And these are some of the items that I sell: medical assistant, everything, medical assistant t-shirts, mugs. I have a medical assistant pillow. I'm going to show you guys this stuff probably tomorrow or Wednesday. I don't want to come on camera tonight. I'm not up to it tonight, but maybe I'll show some of this stuff to you guys tomorrow. Okay. But if you are interested in this necklace or anything you see listed here, you can just go to shopwithmizzk.com under the MA collection. Okay. So this is your first time. If this is your first time here with me, the way it works is that I'm going to show you something on the screen, and then I'm going to give you guys a few seconds to write in the correct answer. Well, to write in the answer, and then on the next slide, I will reveal the correct answer. Okay. If you get anything wrong, it's okay. This is why we're here. Okay. So if you get the answer wrong, it is okay. You don't have to remove your comment or anything like that. It is okay. Anything you see here tonight that you don't know, make sure you make a note to go find out, right? Or, once I give you the correct answer, make sure you add it to your notes. I do recommend having notes while you are watching this if you are preparing for certification. So let's get into it. In which quadrant is the gallbladder located? Now listen, guys, this lesson tonight is open-ended. Okay, so I'll give you guys just a little bit more time to write in your answers because it's open-ended. So I'll give you guys just a little bit more time to write in your answers since it's open-ended. And again, make sure you have pen and paper, okay? And you're taking notes if you're preparing for certification. Let's see. If you put right upper quadrant, yep, you are correct. You are correct. Let's see. In which quadrant is the spleen located? Congratulations, Kiki. She said, I just took my test today. Congratulations. She got her score right away. Congratulations. Kiki has just been joining me for the last few days, and she did let us know her test was today. So, Kiki, we are very happy for you. Congratulations. Yes, Andrea, this is good for NHA, RMA, CMA, AAMA, all of them. Everything. This is all foundational information. This is all foundation information. I want you guys to remember that. This information is the same no matter which test you're taking. It's in the left upper quadrant on the CCMA. It's in the left upper quadrant on the RMA and it's in the left upper quadrant on the CMA, AAMA, NCCT, all of them. Anatomy, terminology, none of this stuff changes. So just remember that, guys. In which quadrant is the appendix located? Congratulations, Leedy. I hope I'm saying that correct. And Jennifer, I'm sorry I missed you. Congratulations. Let's see. The appendix. I might have wrote this wrong, y'all. So please forgive me if I wrote this wrong. I think I might have wrote this wrong because I don't remember. It's the right lower quadrant, y'all. I'm sorry. Sorry about that, guys. And sorry, you're gonna hear me clearing my throat a lot because my allergies are acting up. So please excuse me now. But sorry for that typo, guys. The appendix is actually in the right lower quadrant. Yep, Jennifer, I saw it. I just shouted you out. I missed it the first time. All right. Which type of fracture penetrates the skin? So listen, one thing I do want to remind you guys to take note. So we just had a question about the quadrants. Make sure you know your abdominal area. You should know what organs are in which quadrant. Make sure you know that, just like this question here, right? It says which type of fracture penetrates the skin. Make sure you know all of the fracture types. Okay, so use this video as you're watching it. If you're watching a replay, or if you're watching live with me right now, use this as a guide or as a checklist to know what you need to go back over. Okay. This is a compound fracture. Okay. Now, which type of fracture does not penetrate the skin? Asia says, do you have videos on EKGs? Yes, I do have videos on EKGs. They are, you will have to search my channel to find them though. But yeah, I do have, I have videos. I don't know if you mean like actually doing an EKG. I don't have an EKG video on an actual person. I'm doing it on the skeleton, but I do have videos explaining how to interpret an EKG. Okay, this is a closed or simple fracture. Okay, when it does not penetrate the skin, it is a closed or simple fracture. So make sure you, guys, if you notice something you struggle with, make a note to go look those up. Which part of the body does an arthrogram visualize? Now, this takes us back to terminology. The last few days, we've been doing terminology. So when you have questions like this, you may have never seen the word arthrogram in your life, right? And you may see something on a test like this and a procedure that you've never seen, but it's going to be the terminology, right, that you know that's going to help you answer the question correctly. Which part of the body does an arthrogram visualize? If you put the joints, you're correct, because we know arthro means joint. Which part of the body does an encephalogram visualize? There's another one you may have never seen before in your life, but when you know terminology, you know which part of the body it is visualizing. Hey, Shyla, I see Shyla, you're watching on Facebook. Shyla, are you the Shyla that is an affiliate for my study guide? Let me know, Shyla. Are you the Shyla that is an affiliate for the MA refresher course? Yep, the brain. So we know encephalo means brain. So cephalo is head. I saw some people putting head, but cephalo is head, encephalo is brain. What is an antipyretic used for? That is a type of medication. What is it used for? Okay, so that is you, Shyla. I see you referred a few people. You doing good, girl. I'm gonna up your commission because I said this girl. I said she is really promoting it. I think you had about 3 people join under you. So thank you. I'm definitely gonna up. I think it's like at 10% or something, but I'm gonna up it to 20. So if anybody wants to be an affiliate for my study guide, just let me know. I'll give you guys the link later, and I'll talk about the study guide in just a little bit. Antipyretic, it reduces fever. Yep. Antipyretic is a fever reducer. What is an analgesic used for? Analgesic. Analgesic. Yep. It's a pain reliever. Analgesic is used to treat pain. So again, I'm going to keep reiterating this, guys. Make sure you know your different classifications of pains, okay? So we just mentioned antipyretic, analgesic, now antiemetic. What is antiemetic? Now there's so many more. There's antitussive, there's beta blockers, there are, antibiotics, there are anticoagulants. Make sure you know those medication classifications. And I will do a video this month. As I mentioned to you guys, I'm going live every single day this month. So at some point I will go over the medication classifications, but in the meantime, make sure you know your each medication classification and be able to name some examples of those, okay? So like antipyretic, Tylenol reduces fever, Motrin reduces fever, analgesic, Motrin and Tylenol is a pain reliever. Motrin is also a pain reliever, but Motrin is also an anti-inflammatory as well. And then antiemetic is used for nausea and vomiting, and an example of that will be like Zofran. So make sure you guys are able to recognize a classification and then know some examples of those classifications. Okay, so my MA refresher course, guys, this is just a little, we're just going left for 1 second, just an intermission, just to kind of show you guys my MA refresher course. And I was just speaking to Shyla. She is an affiliate. So that means whenever someone uses her link to sign up, she gets a commission for it. This is helping people pass certifications. This is, you guys know me, this is what I do with my videos already. So I put all of that into a study guide. I've created lessons and quizzes and practice tests and all of that good stuff. So if you are trying to pass certification, or if you just need a refresher, you just been an MA for a long time and you just need a refresher, you can go to marefreshercourse.com. And I've been getting some pretty good feedback from it. So I'm not just speaking because I created it, but people have been telling me it's very helpful and they've been passing certification. All right. What is the meaning of the Latin term for respondeat superior? Respondeat superior. Yanni says, I would like to be an affiliate. Jesse says, can I do that? I have a bunch of people that would love to do that. Yeah, let me, I'll drop the link. While you guys are writing that answer, let me just get the link really quickly. I should have had the link already ready, to be honest. Let me log into my platform. Have you guys started writing the answer yet? Rachel says, you thinking about that, huh, Rachel? Let me look on YouTube. So let me go ahead to the next one. Let the master answer. So I do see Tiana on YouTube got that correct answer to the superior. So that refers to, so let the master answer. That Latin term of respondent superior refers to let the master answer. And what this has to do with is, this has to do with the provider, the physician being responsible for the medical assistant. So the mistakes that we make within our scope, the physician is responsible for, as his license covers, well, not his license, but his malpractice insurance covers us as long as we are acting within the scope of practice. So let's say you accidentally, cause some harm within your scope, giving an injection or drawing blood. And his or her insurance covers you, right? However, if you are acting outside of your scope and something happens, like you're advising, you're diagnosing, right, acting outside of your scope, then their insurance no longer covers you. Okay, so that's just what that means. Let the master answer just refers to the physician being responsible for the medical assistant. What is chondritis? What is chondritis? And we went over some terminology these last few days. So anybody that's been hanging in here with me these last few days, you should know it. And while you guys are answering that, let me get this affiliate application thing. It's just a quick questionnaire. It'll ask you some questions, and then you can sign up, and then you can get a commission whenever anybody uses your link. Inflammation of the cartilage. Yep. Because we know chondro refers to the cartilage. Why would a modifier need to be added to an ICD-10 code? What does modifiers do to an ICD-10 code? Why would we need to add modifiers to an ICD-10 code? Okay, affiliate link. All right, I just put the link in the chat, guys, for anybody who wants to be an affiliate with my online refresher course, and I'll pin it to the top so you can see it. Heather says I need to study this. Yeah, and this is exactly why I do this, Heather, just so you guys can have an idea of what you need to study. So modifiers make ICD-10 codes more specific. Okay, so remember ICD-10 codes can be anywhere from 4 to 10 characters. It used to be 3 to 10, 4 to 10 characters now, and the more characters, the more specific it is. And we'll get into that in another video. I do have a video on ICD-10 coding, guys. If you need a video on that on my channel, if you look under, there's a playlist called lectures. If you look under the lectures playlist, there is an ICD-10 as well as CPT lecture in there. Why would a modifier need to be added to a CPT code? So it does something just a little bit different to a CPT code. You said you were thinking CPT. Let me scroll back up. Oh, okay, Shada. Yeah, okay, I see what you're saying. No problem, Tiana. It says error for the link. Okay, let me see. She said it says error for the link. Let me see. I might need to generate a new link. It's working for me. Let me make sure I copied it correct. It's working for me. Let me know if anybody else has any problem with that affiliate application link. Let me post it again. I just posted it again. Okay, for CPT code, it adds more information about any unusual circumstances. It adds more information to the CPT code. Okay, so any information. So if, let's say, the patient had a reaction during the procedure, let's say 2 providers perform the procedure. Let's say the procedure was done in more than one location. So modifiers for ICD-10 codes, we said it made it more specific. For CPT codes, it adds more information, okay? Particularly like any unusual circumstances. You said you couldn't copy the link. Press and hold it, and I'll put it in the description box as well, Yanni. Don't worry about it. I'm going to put it in the description box. But you can, if you press and hold it, you should be able to copy it. Got you. She said she can't copy. It's a text, not a link. Okay, got you. I'm gonna put it in the description box in a moment. What position is ideal for patients with dyspnea? First of all, what is dyspnea? And what position is ideal for patients with dyspnea? I think for people watching on Facebook, they should be able to click on it. I think you guys on Facebook can click on the link. Yeah, Candace said the link works for, yeah, that's because YouTube, I don't know why YouTube, for some reason, a lot of times they don't even let you post links anymore. Excuse me, y'all. I'm just clearing my throat like crazy. I got allergies and all of that stuff. This weather change. I got a cold coming on. So that's going to be Fowler's. Now, if you put semi-Fowler, now if you won't see an option to choose between the 2 of them, okay? But for the most part, it's going to be Fowler's. However, semi-Fowler's also is used for patients. Like you can put a patient in semi-Fowler's. Let's say you got to do an EKG on the patient and that patient is short of breath. In that case, you don't want to put them all the way up in Fowler's. You want to put them in semi-Fowler's. But for the most part, that they're always going to be referring to Fowler's when a patient is short of breath. Specifically for a patient who is short of breath, is going to be Fowler's. But let's say they're asking about an EKG, right? Let's say if they say you're doing an EKG on the patient and the patient says, I am feeling short of breath, then in that case, you'll put them in the semi-filers because you can bring them up a little bit because remember for EKG, they need to really be lying flat. However, you can bring them up a little bit into semi-filers. So that way they're not laying flat, right? But you also have them laying a little bit because in semi-filers, they're raised about 45 degrees. So that way you have them laying a little bit, right? So you can do the EKG, but they're not laying flat and making their shortness of breath even worse. I'm in DC, Tiana. At what angle is an intradermal injection given? At what angle is an intradermal injection given? And while you guys are doing that, let me come out of here again and let me go to the description box, and I'm going to put that affiliate code, that affiliate link here. I need to just create a custom domain so it can just be easier to get to, and I can just tell you guys what to type in. All right, let's see what you put. 15 degrees. Everybody got it right. 15 degrees. So somebody said 90. So 90, you're thinking of an intramuscular injection. You're thinking of intramuscular injection. And where is the V4 electrode placed during an EKG? Where is V4 placed? Somebody said mid-clavicular. So yes, it's at the fifth intercostal space at the mid-clavicular line. And sometimes it may say mid-clavicular junction. What part of the body does a KUB examine? What are they looking at when a patient is getting a KUB exam? And again, guys, so EKG placements, make sure you know your EKG placements, right? For each one, V1 through V6, as well as your limb leads. Every time we're going through everything we're going through, make sure you're using this as a checklist. Just like the angles for the injections, right? Especially if you're seeing something that you didn't know or something you got incorrect, like this KUB exam. Some of you guys are probably like, what? You know, if you know this is your first time seeing this, make sure you make a note that the KUB exam is referring to the examination of the kidney, the ureters, and bladder. Oh, you know what? I didn't realize I still had that banner on there. I'm sorry, y'all. I didn't realize I still had the banner on there. I'm sorry. So the kidney, ureters, and bladder, and they can also look at some of the GI tract as well with a KUB because they can look at the other surrounding structures around the urinary system. So the way they may ask about this, they may even say which body system is being examined, right? So you know the kidney, ureters, and bladder is a part of the urinary system. So if they ask it like that, either way, you'll know the answer. You'll know the parts, the organs that's being viewed, or the urinary, you'll know the system. All right. Next one. In which stage of grief does a patient refuse to accept their diagnosis? At which stage of grief does a patient refuse to accept their diagnosis? Okay, let me go up here and say this. Okay, guys, so I just put the link in the description box. So you should be able to reach the description box while you're watching, but if not, you can just go to it after you watch the video, but it'll say affiliate link. And let me specify affiliate application link, MA refresher course. And to anybody that may be watching a replay, I know I've gotten comments that said I do too much talking during this, but Listen, I'm not going to not do that, because this is why people join live, so that they can, go over and talk, and we can, converse this way. So if you're watching a replay and this is too much, I'm sorry, but this is why I go live, so I can have these conversations with you guys. All right, denial. Following a venipuncture, how long should you observe the site before applying a bandage? So after you do your venipuncture, right, you've applied pressure, how long do you observe the site before applying pressure? Hold on one second, guys. I mean, go ahead and write that, but hold on one second. Okay. 5 to 10 seconds. Yes. So 5 to 10 seconds. So before you put the bandage on, you want to just look at it for about 5 to 10 seconds, just to make sure it stopped bleeding. How long should you tell your patient to keep on a bandage after venipuncture? Somebody said, I feel like I learned urea. So no, so urine does contain urea, but urine and urea is not the same thing. So it is a waste that the kidneys are getting rid of, but it's not actual urine. It's not the same thing. Urea is actually in urea is actually in urine. Okay. Oops. 15 minutes. 15 minutes. Yep. So you're going to observe it for 5 to 10. So let's go back. So tourniquet shouldn't be on for longer than 1 minute. After you're done, you're going to observe the site for 10 to 15 seconds, and then they're going to keep it on for at least 15 minutes, the bandage. All right. Why must you allow a blood specimen to clot form serum test? So you're drawing your patient's blood. You're working in the lab. You're drawing blood. The test is calling for serum. Why must you allow the blood to clot first before you go put it in a centrifuge? Why should you take time and allow the blood to clot first? So let's say you've drawn up an SST, a serum separator tube, and they're needing serum for the test. Why would you let the blood sit and clot before you spin it down in a centrifuge? Why is that important? I'm gonna give you guys a couple moments to write that in. Okay, somebody said accuracy. Somebody said for proper separation. So serum is the liquid portion of blood after it's clotted. Okay, so you guys know that plasma is the liquid portion of blood, right? Serum is the liquid portion of blood after the blood has clotted, and it no longer contains fibrin. I always say that wrong. Fibrinogen. And once the blood has set and clotted, and the fibrinogen goes away, it is considered serum. So just remember that, guys. So anytime a test is calling for serum, the blood has to the blood has to clot. Okay. And so you were correct, Tiana, when you said for accuracy. Which department is responsible for blood typing? Yep, Rachel. Serum is there after the blood clots. Beforehand is plasma. Yep. Which department is responsible for blood typing? Hi, Tiffany. This is going to be immunohematology. Okay, immunohematology. So again, make sure you guys know each of those lab departments. Know what the cytology department, the hematology, chemistry, microbiology, and I do go through all of this in my refresher course as well. But if you have the study material, of course, you can always review that, or your textbook, whatever you have, you can always review those. But make sure you know those, each of those lab departments, and some examples of some tests that are done in those departments. Which mental disorder may cause a person to continually check the door locks? This type of mental disorder may cause a person to continually check the door locks. All righty. Yep. If you say OCD, obsessive compulsive disorder, you are correct. So this is another one that you want to be familiar with. Now, what I've noticed with the newer version of the test, you guys know that they updated the test earlier this year. And let me just say this, the test did not change that much. So if anybody, I'm still getting hit up like, what's on a new test? It is not a new test. It was just updated. Some extra stuff was added. Okay. I do notice more mental disorders were added. So make sure you're familiar with your with your disorders like OCD, depression, anxiety, ADHD, ADD, PTSD. Make sure you're familiar with those because they ask more questions about these now. And I believe it's because of the pandemic, and also even in the practice, in the medical practice now there are screenings that we have to do. Now we have to screen for depression, we have to screen for suicidal thoughts and stuff like that. And I believe, I'm almost certain that it was due to the pandemic and everything that happened. And so, and because of the prevalence now of mental health, right, mental health disorders, now we have to do those screenings. And now these certification exams have added more questions about mental health. Which type of plan reimburses the provider based on health outcomes of patients and the quality of the service they receive? So think about your different health plans. Which type of plan reimburses the provider based on health outcomes of patients and the quality of the service that they receive? So another thing to add to your notes, if you're not familiar with your health plans, make sure you're familiar with all of your health plans as well. Okay. Now, when I say health plans, I don't mean like you have to be familiar with the different kinds like Aetna, Blue Cross, Blue Shield, right? I mean like the type of plans, like your HMO, PPMO, fee for service, value-based capitation. Make sure you're familiar with those, the type of plans, not actual health plans. Okay. So I don't want you to think you got to know all of everything about Aetna and the different. There's so many different types of insurance. Now, when you get into an office, you'll become more familiar with the different types of insurance. Also, make sure you're familiar. You do need to be familiar with Medicaid and Medicare, as well as TRICARE and CHAMP VA. Let me scroll down, see if anybody put anything on Facebook. Let's see. So I'm scrolling between Facebook and YouTube. So let's see. This is going to be value-based plans. Value-based plans. They pay the provider based on the quality that the patient receives. Okay. Then you got like capitation. You can add that to your notes. Capitation pays the provider based on how many patients are enrolled in the plan, right? Then you got fee for service, where providers are paid for the services that they provide. So, and then of course you got the HMO and PPO, and I'm not going to get into those because there's a few differences between those, but I do have videos talking about those. Which directional term pertain to the back of the body? What's the video called by chance? It is insurance. It should be, so if you look on the playlist section of my channel, Tiana, it'll say lectures. You'll see something that says lectures. It may say administrative lectures, or it may just say lectures. It will be in there, and it'll say and it'll say insurance. I don't know if it says anything else, but it'll say insurance. It'll definitely say insurance. It may say introduction to insurance plans or something like that. Okay, so if you put posterior, you are correct. So directional terms. So I noticed some people put dorsal. So dorsal and posterior, they are often used interchangeably because dorsal also refers to the back of the body. But in this case, we're referring to a directional term. Okay, so dorsal isn't really considered a directional term. So posterior is toward the back of the body, anterior is toward the front. And then I'll mention the other ones in a second. Let's answer this question first. Which directional term describes the position of the chest to the head? And this is going to lead me to the other directional terms I was going to mention. Celine says, I signed up for the MA program. I'm finally pursuing my career. Yes, Celine, I'm glad to hear that. And let me put the call-in link in the comments if anybody wants to call in and ask a question or make a comment. I'm going to put that here because I am going to, we're almost to the end. I did not do a lot of slides. We are almost to the end. Okay, so the chest is inferior to the head. And so the other directional terms is going to be inferior and superior. So inferior is toward the feet or closer to the feet. Superior is toward the head. Okay, we say the anterior is toward the front of the body. Posterior is toward the back of the body. And then you have what's the other ones? You have distal and proximal. So distal is farther away from the trunk of the body or the attachment point, and then proximal is closer to the trunk of the body. And then I feel like I'm forgetting something else. Define the word part pseudo. So transverse refers to the planes, the anatomical planes. So you do have to know those. Thank you for mentioning that, Tiffany. So you do have to know the transverse. So transverse and transverse divides the body into upper and lower, and then you got to know frontal and coronal, as well as the sagittal planes. And then so lateral and medial. Yep, exactly, those directional terms. Superficial and deep. The term pseudo, I see you guys putting those answers in. So pseudo means false or deceptive. How often should you verify a patient's medications? How often should you verify a patient's medications? Yeah, foot is pod or ped, P-E-D or P-O-D. Oops. If you put at every visit, you are correct. So every single visit, I don't even care if that patient was just there the day before. Because prime example, guys, I had a patient who literally was at the doctor from one day to another and the medication changed. Like literally when I was going over her medications, she said the doctor just changed. Oh, as a matter of fact, no, it was the same day. She had just went to the doctor that same day and she said the doctor changed something. So you want to verify every visit. Also allergies. I mentioned to you guys before that I had a patient who, I was verifying allergies and she said, no, I'm not allergic to that. It was like metoprolol or something. I think it was metoprolol. No, it was lisinopril, not metoprolol. It was lisinopril. And I said, hey, I just want to verify your allergies. I have here that you're allergic to lisinopril. She said, I'm not allergic to lisinopril. I just didn't like taking it. So you do want to verify allergies as well. Like, hey, I have here, I just want to verify we have here that you're allergic to penicillin, or, I see here that I just want to verify that you have an intolerance to lactose or whatever. So just verify these things. And of course, you know, you're going to verify demographic information. Well, the front desk will do that. So if there's anybody here who does the administrator side of medical assistant, then you know you got to verify the demographic information every time as well. Because a patient could have moved since the last time they came in. All right. In which area of the body is the pubis, the ilium, and the ischium located? Got to know that this anatomy, guys. Anatomy, you have to know your anatomy. You need to know your parts of your body. You know, you need to know each body system and the organs of that system and the functions of those organs. Okay. You also need to be able to identify some common diseases and disorders of that body system. Okay. Again, these are things I go over in my online study guide. So if you put the pelvic region, you are correct. Which principle of ethics refer to doing good? Which principle of ethics refer to doing good? And do me a favor, guys, if this video is helping you, just give me a like on the video if this is helping you. Just give me a quick like on the video and let me know that this is helping. Yep, Yanni put beneficence. You are correct, Yanni. That is beneficence. And Yanni, you're the one. Yeah, Yanni is the one who had my study guide. Yanni, you know what? You are making me so proud because you are literally showing me that you pay attention. Like, I'm very proud of you. And your test is Wednesday, right, Yanni? Which communication type involves being firm and direct? Oh, ischium. IS. Let me write it in the comments. I'm gonna write it in the comments. Tiana, ISHIUM. All right. Which communication type is that? Assertive. Yes. Make sure you know your different communication types. Passive, passive aggressive, right? Assertive. Which referral type is approved within 24 hours? Let me add an S to that. Which referral type is approved within 24 hours? Urgent. Yep, urgent. And STAT is the one that's approved immediately. Okay. What type of software allows PHI to be encoded so only the person with the key or password can view it? What type of software? What type of software is this that allows which allows PHI to be encoded? So like if you're sending an email to someone, like this type of software will be encoded so that way until it can't be read until it gets to the person that it's supposed to get to. They need a key or password to receive it. All right, I see the answers coming in already. Encryption, yes. So Outlook is email. A patient who is expressing the opposite of what they feel is displaying which type of defense mechanism. So again, checklist, make sure you know the different types of defense mechanisms as well. So the patient is expressing the opposite of what they feel, okay? They're expressing the opposite of what they feel. Let me go to look on Facebook too. Okay, so this is going to be reaction formation. Okay. There's regression, where the person may, they'll regress back to like being like, like childlike. And then you have repression where they may hide, so I think repression, I got to look repression up. I think repression is when they hide certain things. I'll double check on that and make sure. It skips my mind right now, but I think the repression one is the one when they are hiding certain things, or they won't say everything of how they're feeling, I believe. What are some examples of CLIA-waived tests? And you guys can just, there's quite a few. On the next slide, I do list some of them, but you can just give me some examples in the chat. Okay, I see you guys putting some in. Yep. I see rapid strep, HCG, pregnancy. Yep. So you on pregnancy test, glucose, strep testing, micro ESR, and this is just a few. So even like cholesterol testing, hemoglobin A1C, also what else? Fecal occult blood testing. What else? There's quite a few, but you guys know that these are tests that are low complex tests. They can be performed in an office, at home, in pharmacies, right? Nursing homes. And it's pretty easy to do. They don't require a whole lot of special training and certifications. When you get into like the moderate complexity tests and high complexity tests, you do have to be, trained and certified to be able to do those type of tests. So like providers, they do moderate complex tests by looking, they'll get a specimen collection and maybe they'll look under the microscope. That's a moderate test that can be done in the office. And then, but for the most part, moderate and high complex are sent off to a lab, to a reference lab. Yep, COVID testing is one. Which gland produces hormones that regulate metabolism? Which gland produces hormones that regulate metabolism? Rachel say hard to mess up. Yep, these are done in the office. Yep. All right, I see the answers coming in. Thyroid gland. If you guys put the thyroid gland, you are correct. Not to be mistaken with the thymus gland that produces T cells and is a part of the immune system. The thyroid gland is a part of the endocrine system. The thymus gland is a part of the immune system. All right. Which cavity contains the brain and spine? Which cavity contains the brain and the spine? Heather said I said it out loud again. You said it out loud like we can hear you. That is funny. Hey, Janice, welcome. Which cavity contains the brain and spine? The dorsal cavity. And yes, the dorsal cavity does contain the dorsal cavity does contain the spinal cavity as well as the spinal cavity. So guys, so remember the cavities are, you got your dorsal cavity, right? And that contains the cranial cavity, which contains the brain, and also the spinal cavity, which contain the spinal cord. Then you have the ventral cavity, which is the front, right? That contains the chest, and what else does it contain? Oh, the abdominal cavity, right? That it contains the thoracic cavity and the abdominal cavity, right? And the pelvic cavity. That's your ventral cavity. So I'm gonna just go over that one more time. You got two big cavities, right? You got the dorsal cavity in the back that contains the brain and the spinal cord. Then you got the ventral cavity. Oh, let me go back. Hold on, let me go back one more time, y'all. We're gonna do this one more time. So you got the two big cavities, dorsal cavity and ventral cavity. The dorsal cavity in the back contains the cranial cavity, which contains the brain. And it also contains the spinal cavity, which contains the spine, right? Then the front of the body, the ventral cavity, contains the thoracic cavity, which contains the chest and the lungs and the heart, right? And it also contains the abdominal pelvic cavity, which contains the abdomen and the pelvis, okay, the pelvic cavity. Okay, so that was it for tonight, guys. Let me know if you have any questions, guys. If you need my study guide, you go to marefreshercourse.com. Let me know if you have any questions. I will stay on for a few moments. I hope this was helpful to you guys. If you did not know, I do plan to go live every single day this month, going over different topics. This is going to be it for the certification practice for a couple of days. I have some other topics that I'm going to be talking about this week, which is we're going to be talking about finding a job, resumes, and all of that stuff throughout this month. So today was the last, well, not the last day of the month that I'm going to be talking about certification, but just the last day for a few days, because I've been doing certification practice the last few days, and I don't have time this entire week to make slides like this. It does take a while to create these slides, so I'm going to get back to that soon. Candace says, thank you. When will you go live for CMAA? I'm not exactly sure yet, Candace, because I don't have time to do these slides. It takes me a long time. So I'm going to try by the end of the week, but I can't promise it. But I definitely will be going live to talk about different topics. Rachel says, I keep telling my classmates about your videos. Oh, awesome. Thank you, Rachel. Don't forget to like the video, guys. If this was helpful, will it be around the same time frame? So tomorrow, yes, Jeanette, when I go live tomorrow, it should be around the same time. I did go live yesterday, Heather. I went live about this time yesterday. Yeah, I think it was like about this time yesterday. Candace said, okay, that's fine. But I'm definitely going to try though, Candace. I definitely want to, because it was a few of you guys that asked for the CMAA. So I'm definitely planning to. I just know that I know it definitely won't be tomorrow or Wednesday. Possibly Thursday or Friday or Saturday. But I know it won't be in the next couple days. All right. I'm going to wait a couple more minutes just to see. Don't forget to like the video, guys, on your way out. Are the lives on YouTube to watch later? Yes, they all stay. So what, YouTube and Facebook, they're going to stay on Facebook and YouTube. Thank you guys for hanging in there with me. We've been on here for 54 minutes. And let me just scroll up to make sure I didn't miss anything else here. And then don't forget, if you guys want to be an affiliate for my MA refresher course, that just means that you get your own personalized link. So if you refer my refresher course to someone and they purchase it, you will get a commission for that. And Teachable is the platform I use to create my course, and they are the ones that pay you the commission. So they just basically take some of what they would have paid me for my course and they send it to you, and they pay out once a month. So it's just like an extra source of income. It's not a lot, but it can build up if you refer a few people. Like, I don't know if Shyla is still on here, but Shyla is one of the ones who is an affiliate, and she has a few people that has signed up, because when people sign up, I can see who link they used, and it'll automatically assign you a commission. So Terry says, where can I get the study guide again? So marefreshercourse.com, Terry. So right there on the screen, if you go to marefreshercourse.com, you can get it there. Akuru, congratulations. You're welcome. Congratulations. Congratulations to everybody that passed. I know I missed some during the live. I try not to stop too much to congratulate everybody, but congratulations to anybody that has recently passed that I didn't get to shout out already. And yes, I will be live again tomorrow around this same time, probably about 6 or 6:30. But it won't be certification practice. So just remember that, guys. There's going to be another topic, but it's not going to be certification practice. I don't have time to do these slides then in the next couple of days, so I have to wait until I can get some time to create some more slides like this. Okay, I don't see any questions, so I'm going to go ahead and let you guys go. And I will see you all tomorrow. Let me just scroll up one more time and make sure. Okay. All right, guys, you all have a good evening. See you tomorrow.